Are you tired? Are you having trouble sleeping? Well, you're not alone. This is a problem across the world, particularly in the United States. And there are some things that we can do to improve your sleep hygiene. And I want to talk about those today. Before we get started though, it's important to recognize that there are tons of different sleep disorders, from restless leg syndrome to obstructive sleep apnea to different parasomnias. And some of these reflect underlying medical conditions, other times they just reflect the sleep disorder itself. But it's important to talk to your healthcare provider if you're having any features that do not improve, or your insomnia or your ability to sleep is starting to impact your ability to function normally, because there are lots of options available for treatment. But let's get started with some sleep hygiene techniques that you can use today to start feeling better. One of the easiest things to do is start having a specific bedtime routine and sleep schedule. So when I say a sleep schedule, this means that during the week and on the weekends, try to go to bed around the same time. If you can do this within an hour every single night, then you're better off at allowing your body to generate a circadian rhythm that it can fall into. If you're going to bed at 10 o'clock during the week and then 2 a.m. on the weekends, you're really not giving yourself much of an advantage in terms of being able to have a consistent sleep schedule. And this really does impact your ability to get restorative sleep. The next thing that you can do is start setting up your bedroom so that it's cool, it's dark, and it's without the presence of electronics. Because when your bedroom is used for anything other than sleep and sex, it begins to create associations within your mind that you should be thinking and responding internally to other stimuli. This is especially important when people start using their time when they first lay down to watch TV or to talk on the phone. And these things can be very arousing, and even the light emitted from some of these devices is too stimulating to allow your body to go restfully into bedtime. And using the 30 minutes or 45 minutes before bedtime to start winding down, whether it's having a quiet, non-arousing conversation with a partner, or reading a book, or doing some breathing exercises or meditation, any of these things just to start slowing down as you get into bedtime are important. One of the next things is watching the amount of caffeine that you have in your day and trying to limit this within about 10 hours of sleep, because some people are very sensitive to caffeine. It affects most people differently. But if you're having trouble sleeping, limiting caffeine close to bedtime is very important. In the same way, exercise is so helpful to allow your body to be tired when you go to bed physically. But if it goes within about 5 hours of bedtime, then it might impact sleep negatively. So I encourage exercise daily if possible, but try to do it earlier in the day or by the late afternoon so it doesn't have a negative impact on your sleep. The next thing would be related to drinking, both alcohol and just fluids in general. So when you're drinking close to bedtime, you're more likely to have a full bladder and then wake up during the night and urinate. So limiting fluids within a few hours of bedtime, trying to urinate before you go to bed, and not drinking alcohol after mid-afternoon can help promote more restorative sleep. And although alcohol does promote people to fall asleep quicker, it doesn't improve the sleep architecture. So most people actually wake up in the middle of the night even though they fell asleep quicker, and they end up getting less restorative sleep. So alcohol is not really a solution, unfortunately. Finally, only go to bed when you're actually tired. And I know this is difficult sometimes related to work schedules, but if you're laying down at a certain time every single night and you're not actually tired, you're just going to be awake laying in bed, and you're going to create associations in your mind about why am I not sleeping right now, and then you're going to not sleep because you're thinking about not sleeping, and it becomes a spiral. So try as much as you can to lay down only when you're tired, and if you're not able to sleep within 20 minutes of laying down, get out of bed, go to a different room, do something quiet and relaxing, whether it's reading a book or trying some meditation or breathing exercises again. And then when you become tired, go back to bed and try it again. And you can repeat this as often as necessary, but eventually you'll start to train your mind to be ready for bed in the bedroom, which you've set up in a cool, quiet environment after you've developed a proper sleep routine and a consistent sleep schedule, and you've exercised during the day, and you have not had alcohol, and you've urinated before bedtime, and then you will hopefully have improved sleep. If any of these things do not work, then please talk to your healthcare provider. There's lots of other options available. One final comment on melatonin. This is a very common, popular medication to use. There's different strengths available. Somewhere between 3 and 5 milligrams is the most commonly used dose and the most effective. The people that are going to get the most benefit are those that are on different cycles of work, so shift work, whether it's shifting between days and nights or somewhere in between, or that take a flight to a different time zone. And this helps readjust your circadian rhythm so that you can have more restorative sleep. But in general, using it for a couple of months as a trial has very little side effects or harm, and you take it about 30 minutes before bedtime when you're going to bed consistently at the same time every night, and it can help improve your circadian rhythm so that when you do lay down, you're more likely to get some sleep. So I hope this was helpful. Let me know if you have any questions, and go get some rest.